And as we have just seen, there seems to be no end in sight in the near future with the dominance of the heavily infectious Omicron variant. What will things look like in the coming weeks following all those holiday get-togethers that we just experienced? Joining us on BNC Live to give us some insight on a possible post-Christmas surge from the University of Illinois, Dr. Christopher Colbert. How are you? And happy holidays to you. How's it going?
I'm doing well.
Great.
Happy holidays to you as well.
Thank you. So Omicron, heavily infectious, as we know. Why has enough emphasis not been put on maybe some stay-at-home orders or mask mandates?
I think as we continue with this struggle with this vaccine, there's more and more conversation, specifically in reference to mask mandates, wearing more masks, expecting and having vaccination cards when entering large areas as well. So it's just not New York as what was communicated earlier. It's also in Chicago. It's also in Philadelphia. There are more cities that are adapting these policies to ensure the public health and safety of individuals in their communities.
Are health experts saying that the typical masks aren't enough? Do people need to do more?
So that's a fair question, and it's a very common question now. The recommendations are indirectly to use more N95 masks, specifically because Omicron is more transmissible and there's a balance between transmission and there's just more people traveling. There is a higher number of individuals traveling by plane, trains, and automobiles in 2021 than there were in 2022. So to offset those numbers, we recommend to using a more sturdy mask, and that would be the N95.
Okay, some great advice there. When it comes to these mandates, how effective are they, Dr. Colbert?
It's difficult, and I believe they're in the right place. And it's just difficult to uphold those mandates. It's so when you walk into those areas, who's responsible for maintaining that conversation and to ask people to leave those facilities? The mandates will work. Asking people to just have shared responsibility and be courteous and abide by recommendations honestly shouldn't be a huge lift, but it is. The biggest challenge with addressing COVID is human behavior. If more people received the vaccine, if more people wore a mask and were more cognizant of space, we would definitely have less people come to the hospital with severe symptoms and admissions as well.
We're all kind of bracing, I guess, for impact with what is expected to be a post-holiday explosion. What would that look like? How is that going to impact healthcare workers? And also, how would that impact our daily lives possibly?
So in reference to hospitals, it's really tough because as opposed to last year, and just in reference to the bed availability, now we have bed availability, which is in question, and also staffing as well. The staffing has significantly decreased across hospitals across the United States. And so now we are marrying the bed availability, bed resources, and staffing as well. We're concerned that in the next 2 weeks, we're going to see an increase in admissions and an increase in call-offs as well, which is some of the things that we're seeing, in fact, with the airlines. And so, again, our recommendation is to get the vaccine. It's never too late to get the vaccine and the booster, and as well as to ensure the safety of yourself and your family by wearing the mask.
For sure. Obviously, New Year's Eve, a couple days away now. A lot of people are going to still celebrate. What is some advice you have for them in terms of the best way that they can still celebrate the holiday, but do so as safely as possible?
So this is a conversation of having just realistic expectations. People are going to go out on New Year's. I totally get that. But my recommendation is if you're going to have people in your home, be mindful, make sure that these individuals are vaccinated, and that your groups are small, 10 individuals and or less, and 2 different households. For those individuals who have not received the vaccine, for whatever reason, make sure you communicate that to the host of the event. You'll be surprised at how many individuals that we admit to the hospital, and there just wasn't that conversation. And someone says, well, we didn't know X, Y, and Z was not vaccinated. Have that conversation and enjoy the New Year's, bring the New Year's in, but do it safe based on the recommendations of the CDC, wearing your mask, having small groups, and enjoying going into the new year.
Do you think that the news that the Omicron variant is a little less likely to cause hospitalizations, do you think that has made people a little less likely to take precautions or even to get vaccinated, as you're mentioning?
I do. I think there's a direct reflection. I think that once people hear, well, there's a milder form of it, they blow it off as if it's taco sauce. It's extremely important to realize that having a milder form, but the transmissibility means that it's not going to decrease the caseload that comes to the hospital. It just means those individuals are going to come to the hospital and have less likely negative effects long term than they would with Delta. But it doesn't mean they're not going to come to the hospital. It doesn't mean their pulse ox will be low and their vitals will be low, requiring them to be admitted to the hospital. And again, that's why the big theme is shared responsibility. Because as we pack the hospitals and pack these beds, we have individuals in the triage that need to be admitted that there's just no bed availability. So as long as we adhere to recommendations, we can honestly move forward in a good direction.
All right, shared responsibility. That's what we want to take away from your interview, Dr. Colbert. We appreciate your time and Happy New Year to you. Thank you so much for joining us today.